Good afternoon, folks. Discussion B is deep medicine, the idea that artificial intelligence can restore the human side of healthcare by taking over routine, data heavy tasks so clinicians can spend more time listening, diagnosing thoughtfully, and connecting with patients. Deep medicine means deep medicine is both a concept and a programmatic vision, coined and popularized by cardiologist Eric Topol, arguing that AI, machine learning, natural language processing, computer vision, and genomics should be used to make care more accurate, personalized, and humane by removing administrative burdens and argumenting clinical judgment. Core components of deep medicine: automation of routine work. AI handles documentation, coding, and data extraction. So clinicians spend less time on EHR clicks and more time with patients. Argumented diagnosis. Machine learning models analyze images, labs, and longitudinal records to surface likely diagnoses and rare signals clinicians might miss. Personalized care, integrating genomics, wearables, and continuous monitoring to tailor prevention and treatment to the individual. Restoring the doctor patient relationship by freeing up clinician bandwidth. The goal is to enable deeper listening, shared decision making, and empathy. Concrete examples: AI image interpretation that flags subtle findings on x rays or MRIs to speed diagnosis. Ambient scribing that converts clinician patient conversations into notes, reducing after visit paperwork. predictive monitoring, using wearable data to detect early deterioration or tailor medicine choices. Why it matters now. Deep medicine reframes not reframes AI not as a replacement for clinicians, but as a tool to recover what modern healthcare has lost: time, attention, and human connection. If implemented thoughtfully, it promises fewer diagnostic errors, more personalized treatments, and improved clinician well being. Key consideration and risks: data quality and bias. AI is only as good as the data it learns from. Based, biased data sets can worsen disparities. Clinical safety and oversight. AI suggestions require human validation and clear accountability. Privacy and consent. Integrating genomics and continuous monitoring raises consent and data sharing questions. How to explain deep medicine to patients and colleagues. Simple pitch: AI will do the paperwork and data heavy detective work so your clinician can focus on listening and making decisions with you. Reassure about safety. Emphasize that all AI algorithms not replaces clinician judgment, and that safeguards and oversight are essential. Artificial intelligence is reshaping modern medicine by transforming how diseases are detected, how treatments are chosen, and how entire clinical ecosystems function, often with a level of speed, precision, and pattern recognition that exceeds traditional traditional methods. What what once felt futuristic is now woven into everyday care across diagnostics, genomics, infectious disease, cardiovascular medicine, pediatrics, and hospital operations. How, how AI strengthens diagnosis. AI's greatest diagnostic power comes from its ability to see patterns across enormous data sets. Imaging, genomics, lab values, pathology slides, and even clinical notes. revealing signals that human clinicians may miss. Rare disease detection. Multi-agent systems like Deep Rare outperform specialists identifying correct diagnoses in the top prediction 6.4% of the time versus physicians 54.6%. This matters because rare diseases often hide behind vague symptoms and long diagnostic odysseys. Pediatric diagnostics. Children's symptoms can be subtle. Atypical and AI models trained on millions of cases can detect patterns that even experienced pediatricians may not immediately recognize. Cardiovascular disease prediction. Machine learning can analyze ECGs, imaging, and EHR data to flag silent heart disease years before symptoms appear. Infectious disease detection. AI improves pathogen identification, antimicrobial stewardship, and outbreak surveillance, helping clinicians respond faster and more accurately. Medical imaging, with 76% of FDA approved AI medical devices focus on radiology. AI now helps detect cancers, neurological disorders, fractures, internal bleeding with remarkable consistency. AI doesn't replace radiologists or clinicians. It gives them a second set of eyes, one that never gets tired. How AI helps select the right treatment. Diagnosis is only half the story. AI is increasingly central to precision treatment, targeting, integrating genomics, imaging, lifestyle data, and clinical history, genomics driven care. Programs like Australia's Acute Care Genomics deliver whole genome results in 29 days, influencing treatment decisions in 77% of diagnosed cases. Personalized surgical planning. Machine learning helps epilepsy surgeons predict which patients will benefit from specific procedures, reducing unnecessary surgeries. Treatment optimization in infectious disease. AI supports antimicrobial selection, monitors resistant patterns, and tailors therapy to individual patients. Risk based cardiovascular therapy, predictive analysis helps clinicians decide who needs aggressive intervention and who can be safely monitored. This is the shift from one size fits all medicine to deeply individualized care. How AI enhances specialized medicine sectors. AI is now enabled across nearly every clinical domain, often in ways patients never see. Radiology, automated imaging, triage accelerates stroke and embolism detection, alerting teams in real time. Surgery, AI supports robotic precision surgical navigation and intraoperative decision making. Allied health, speech therapy, nutrition, mental health, and physiotherapy use AI assessment, process tracking, and personalized plans. Drug discovery, AI accelerates biomarkers discovery, protein modeling, and candidate screening, shrinking timeless from years to months, timelines from years to months. Clinical research, AI identifies ideal trial participants, predicts dropouts, risks, and flags early signals in data. Hospital operations, automated documentation, scheduling, billing, and triage reduce clinical burnout and improve patient flow. Challenges and considerations. AI power comes with responsibilities, bias, and data gaps. If data sets underrepresent certain groups, AI can worsen disparities. Inter, inter, Interpretability, clinicians need to transparent clinicians need transparent models to trust recommendations. Regulation and safety. Who warns that large language models can hallucinate and are not approved for medical advice? Infrastructure inequity. Lower resource regions risk being left behind. The big picture. AI is not replacing clinicians, it is augmenting them. The trend reflects a global shift toward faster, more accurate diagnostics. Okay, I will jump on later for more shows. For now, Gator Wellness. Take care, folks.